Okay, so now let's go to the FRCOPHTH London. What are the specs of the FRCOPHTH London? The pathway can be the longest. So despite other exams, other qualifications can be only 3 stations, now we have 4 stations. Starting by part 1, a basic sciences test with no experience required. Then the refraction certificate, which can be taken anytime before part 2 oral. Again, back in the days, 4 years ago, it has to be following this sequence. Like you need to pass part 1 in order to be eligible for refraction certificate. I think in 2022 these rules have changed, and now you can take the refraction certificate at any time. You can take it before part 1, after part 1, before part 2 written, or after part 2 written, but it has to be before the part 2 oral. This is the only condition. And then you need to clear part 2 written, and the eligibility for part 2 written is that you need to pass part 1 written. And after passing the 3 exams, you become eligible to the part 2 oral exam. And then after passing the part 2 oral, you are entitled the post-nominal FRCOPHTH, or you become fellow of the Royal College of Ophthalmologists in London. Okay, so this is the pathway for exams, 4 stations. What are the logistics? Part 1 is 180 questions divided into 2 papers with 1 hour break. So it's total 4 hours. Refraction certificate, which is 10 stations in 10 minutes. Again, I think in 2022, this has changed. So it was on dummy eyes or on eye models, retinoscopy on retinoscopy models. Since 2022, October 2022, it's becoming on real patients. So the exam combination will be on real patients and on retinoscopy models, and there is also subjective refraction. So the exam has changed. Part 2 written is 180 MCQs in 4 hours as well. Then finally, part 2 oral, 5 stations, 10 minutes oral exam, 6 20 minutes practical exam stations. Actually, one of these 6 is as an oral exam, but the communication skills station, but you are examined on communication skills with the practical exam. So where do you do this exam? The written parts, like part 1 and part 2 written, are done online. The practical parts, the refraction and the orals, are done face-to-face in the UK, Pakistan, India, Egypt, and UAE, and others. So the next dates you can check, there is a huge timetable in the Royal College website called the examination calendar. You can check the next date, and the fees can be variable. For the written exams, £725. Refraction variable. Refraction and oral exams are variable depending on where do you sit the exam. Usually the UK test centers are cheaper than the international test centers. So if you did your exams in the UK, I would believe also the range of the whole journey can cost around £3,000, which is quite similar to the FRCS Glasgow. So what is the pros and cons of the FRCOPHTH London? It is the strongest UK exam route, and by strongest it means that it opens all the doors. So any door that can be opened by a UK fellowship exam, it will be opened by the FRCOPHTH London. For example, if you want to get GMC registration to apply for jobs, apply for fellowships in the UK, you can get that with the FRCOPHTH London. If you want to apply for training in the UK, you will need FRCOPHTH. If you wanted to become a substantive consultant in the UK through Caesar pathway or portfolio pathway, the FRCOPHTH is one of the prerequisites, or it can tick some, or not some, many boxes required for your application for the Caesar and portfolio pathway. Highest credibility in the UK, so most UK doctors do the FRCOPHTH London it is usually they know little or nothing about FRCS Edinburgh or FRCS Glasgow. Also, another advantage is that it does not require experience, as it does not mean that you can pass it without experience, but it does not require experience as an eligibility criteria. So, for example, like if you are a fresh graduate and you have the necessary knowledge and the skills, you can clear all the steps even in 1 year. Part 1 and Part 2 are online, so you can do it at the comfort of your home. So here is the paradox. I can tell you something contradictory, like it is the fastest but the longest. What does this mean? It is the longest means is that it is the exam that requires 4 stations. So you need to pass through 4 steps, 4 stations, 4 exams. But it is the fastest. It means that if you are good enough, if you are dedicated, you can clear it as faster than other pathways. So to give you an example, that when I started my fellowship at Moorfields in 2022, I like a month later, I applied for the Part 1 FRCOPHTH London, like the basic sciences. And surprisingly to my colleagues and my supervisors, I didn't apply for any study leaves or any, I used it to work till the last day before the exam. I have informed only few people that I'm going to do an exam tomorrow. And then after doing the exam, and once the results showed up and I passed, then they told me, how did you do that? Like we thought that you are still like naive, you didn't know how the exam is structured, quite difficult exam, and how did you pass the exam? And then a month later, I passed the refraction certificate and Part 2 written exam, also without any study. And then they become like crazy. Like I remember my supervisor at Moorfields, she told me like, how did you do that? I have never seen someone like that before. So of course this is from the teaching, but the bottom line is, or the moral of the story, like I passed 3 parts in 2 months. So if I can do that, anyone can do that. So you can still, it is not like you're going to wait for a long time for passing part after part. It can give you the, if you are keen to clear these exams, it can be the fastest route. And there's an advantage that also showed up, like becoming available like 3 or 4 years ago, which is a FRCOPHTH certificate. Like after passing Part 1 and Part 2 written exams, you get a title called FRCOPHTH. FRCOPHTH, which is equivalent to membership in Glasgow and Edinburgh. So you can get this exam after only the written parts. So you don't need even the refraction. After passing Part 1, Part 2, which is purely theoretical, you can do them in your first year in training, and you can get a title in your first year of residency. So I don't think that any other qualification can offer you that. Of course, it goes without saying that it is the most challenging and most demanding pathway. So it is in terms of difficulty, it can be the more difficult. We can argue about that. So if you argue about what kind of difficulty you would expect from an exam, like I would call internal medicine part of or general physiology and general biochemistry and general anatomy, heart anatomy in FRCS Part 1 Glasgow more difficult than being examined on ocular investigations, for example, in Part 1 FRCOPHTH. But this is different from one to another. But no one can argue that it is quite extensive exam. It requires extensive amount of study and some sort of skills and some sort of experience. There are questions that you will answer by experience, as in Part 1 This is the only exam that can give you some clinical investigations, photographs, and ask you to comment on them, as they would expect someone like you, like in the UK training system. They would do this exam in their first 2 years of training. They would expect that you have some clinical exposure, even though that they are not formally requesting it. The second thing is refraction requires skills. Of course, you need to practice on the refraction. So this is the only exam so far that tests refraction. As I said, back in the days, more than 10 years ago, I did my MRCS Edinburgh exam, and I did the refraction test. So it was like on retinoscopy, on cross-cylinder, and I can share you a secret that the refraction test of the 9 stations of the FRCS Edinburgh, of the MRCS Edinburgh, this was the only exam that I didn't manage to pass from the first time. All other exams, whether it is ICO, MRCS Edinburgh, FRCS Ophthalmology Glasgow, FRCOPHTH London, I managed to pass from the first time, except this refraction test. So I can't forget it. Good news is that it is no longer offered, but now the refraction is asked and requested in FRCOPHTH London. So you need to be aware of this. Also, the other disadvantage is that there is no other exam that can exempt you from any part of FRCOPHTH London. So if you did like Glasgow, if you did Edinburgh, and you wanted to shift to FRCOPHTH London, you will still have to repeat the exams all over again. Also, NHS experience, it is an advantage. If you have worked in the UK and you understand the UK culture, the NHS environment, then it can give you some advantage that you will answer some questions in the final oral exam by experience. But of course, anything can be studied. Me and others are already transferring the knowledge, and we are orienting our colleagues about what are the things that can be familiar in the UK culture, but not in our or in home country's culture. So we transfer this knowledge, so it is not a big issue anymore. If you are in the training system in the UK, you don't need me to tell you that, but you already know that there is a certain time limit to do every part of the FRC of the exams within your training. So you know already that you will still need to clear each part within certain duration. All right. Here is a good part about exemptions. If you started the FRCOPHTH London, it can exempt you from other exams. So it can exempt you from FRCS Glasgow Part 1. So let's say, for example, you did FRCOPHTH Part 1 London. You did the refraction certificate. You struggled with it. You no longer want to continue the FRCOPHTH London. You can shift to FRCS 2 Glasgow, but not the other way around. The full FRCOPHTH London can satisfy the prerequisite for European Board of Ophthalmology subspecialty exams. We will come to this in the next slide. So in order to apply for subspecialty exams in certified by the board, the European Board of Ophthalmology, you need to clear the European Board or equivalent, and the equivalent here can be the FRCOPHTH. Okay? Is it clear? So this is, in a nutshell, what you need to know about the FRCOPHTH London.